We're in Basel at the INSEAD Alumni Health Conference, and Gert Hoogland, it's good to see you. Thank you for being with us. You're the CEO and the founder of Pharmaplan, and you're kind of a facilitator for healthcare companies that want access to South Africa.
Yeah, that's correct. About 12 years ago, when I came to South Africa, I perceived there was a need for a company that would do justice to the small to medium-sized international pharmaceutical companies that either didn't see South Africa as a priority to set up their own operation, yet had drugs that that would fit that market well. So, yeah, the way that you can think about it is we are like a department store with a whole lot of boutiques in the department store. And in that way, we represent a fair number of blue-chip, mid-sized companies that would otherwise not bother to come to South Africa.
Because they don't have to then have an actual presence. You take care of all of the administrative. You are their presence, so it's easier for them to do business. Why would a company want to do business in South Africa? What makes it so unique?
First of all, when you think of the economics of drug development, a lot of the upfront costs sit in the R&D. Yeah? By the time you have a dossier, you want to spread your wings as far as possible. Yeah? You want to roll out that drug in every market you can possibly get. So, and that includes, of course, South Africa. But as I said, South Africa is a relatively small market. It's 0.3% of the world market. It's a complicated market. Yeah.
Well, you have both the highly developed and you've got and sub-Saharan Africa of undeveloped. I mean, you've got both extremes. So
that's right. So that makes it even more interesting, yeah, from a business perspective. And it's also one of the reasons why, whilst we started off representing purely R&D-based companies, over time we have also migrated towards representing leading generic companies, sort of now known as the hybrid model. And funnily enough, over time, you find that many of the R&D-based multinationals have gone that same route.
Now, what kinds of financial support can the government offer to companies doing business there, or that you can offer through the government? What kind of financial support does the government give for this?
Government doesn't give any financial support to pharmaceutical companies in South Africa. There are no barriers either. Yeah? We don't have import duties on pharmaceuticals, for instance. So it's pretty much an open market. There are certain advantages for producing locally, particularly that are of interest for public health, so HIV/AIDS, TB. And then there are additional advantages for having a BEE partner, Black Economic Empowerment Partner. And if you are transforming according to the mix of population in the country.
Who is your competition for drugs? You've got China and India manufacturing. How do you handle that?
Yeah, locally, of course, just about every company is a competitor of ours. Many of the multinationals, the top 20 R&D-based companies in the world are in South Africa by means of their own subsidiary. As I said, what we do is we try and focus on niched specialty pharma companies, and of course we try to represent them as best as we can, and we make sure that we don't have conflicts of interest between them. Now, in that way, we are able to tap into the R&D facilities of a dozen companies, if you like. And that way, we can actually compete quite effectively with the major companies in South Africa.
Now, pharmacies are actually corporately owned in South Africa. That's kind of a new law of about 5 years ago. How does that impact your business if a corporation owns the pharmacy?
I think it's not necessarily a bad development. Yeah? What you get, of course, is a better level of professionalism. One of the chains that we deal with is called Clicks and is run by a person who used to be the, I think, commercial director of Boots. And he's taking the Boots model and is implementing that in South Africa. Of course, as far as we as suppliers are concerned, there are good things and there are bad things. Yeah, they're better organized, their stock levels are better, they are better monitored, but also they are tougher to deal with. So, yeah, they're much more demanding than dealing, of course, with 3,000 retail pharmacies that are unrelated.
I would imagine they keep you on your toes somewhat. For sure. There are also price controls in South Africa on drugs. That seems to be a terrible impediment looking at it from the outside, but how does that affect you?
Yeah, there is such a thing as SEP, a single exit price, and that's something that gets published. Yeah, so we have a public price, effectively, that gets published. Now, when the SEP was introduced a couple of years ago, it definitely pushed down the price level. But of course, over time, there are very few markets where prices do go up. Yeah, I mean, without price control. So I don't think that impact of SEP is as big now as what it used to be. But what it does mean is we cannot up the price. For instance, if there is a sudden deterioration in the value of the rand versus major currencies, we sit in the sandwich. So that's difficult and dangerous. We have to cover forward. Yeah? We have to cover ourselves for that to happen. If competitors come in and compete on price and bring prices down, we can follow, but we can't go up. So, yeah, it's a way of government to deal with what they perceive to be an excessive price level in the private sector. Yeah, the public sector is entirely different. That's pretty much run on a tender, 2-yearly tender basis, and sort of the best price wins.
Well, this conference has looked at kind of the health delivery and costs and reforms, and it seems as though some of the healthcare changes down the road in the near future are going to be dealing with pricing. As you look down the road for the healthcare industry, what do you see?
I think the environment will generally be tougher. There will be pressure on prices. Yeah, South Africa, as the whole of Africa, suffers under a great deal of infectious diseases. Yeah. HIV/AIDS, good example. TB has been declared a national emergency about 2 years ago. So I think the level of competition will go up. With that, price levels will go down. But I think there is a counter, and that is there is, of course, a tremendous unmet need for medicines. So volumes will also rise quite considerably. And if you look at the market so far, and I'm just quoting IMS, I think for the year to June, the market was up 15% value-wise. And that's quite remarkable, whereas Western markets are sort of going nowhere or actually diminishing.
Gert Hoogland, thank you very much for being with us.
Absolutely my pleasure. Thank you, Shelley.